day now, and I'm going to be featuring the guest of the day right here on Startup Central. Today we're getting a big one. It's a co-founder of PolicyBazaar, Yashish Dahiya, who's joining us right here live on Startup Central. Yashish, hope all is well with you and your team. I know you're in London. I hope that's out of choice and you're not locked out. First up, I want to ask you, how has COVID-19 been for PolicyBazaar and the insurance world?
So on the insurance side, except for one area, which is travel insurance, most other areas are doing quite well. And health insurance, life insurance in particular, are there's a lot of demand for it. Now, one can look at it slightly negatively in the sense that there's fear of the disease and hence the demand for health and life. But when COVID people are going to, when COVID patients are going to hospitals, less than 10% of them have insurance. I think that's an indicator of most hospitalization in the country. That when people turn up at a hospital, they don't have insurance, and that puts a very major financial burden on them. So in a way, it's great that some people are finally buying health insurance and life insurance, which is anyway a massive necessity.
Okay, so let's pick up on all of that bit by bit. You know, you're saying it's gone well. Forget travel insurance. Yes, it's sad that, you know, your business is benefiting, which basically means that people are falling ill and all of that. But Yashish, I want to ask you this one question. You know, we are being told by hospitals at least that they're not full because a lot of people are not doing the elective surgeries. They're not going in for elective procedures. In fact, you know, there have been very disturbing reports on how cancer patients have been suffering as well. But the insurance business is picking up, you know, the two don't seem to match.
You are absolutely right. In fact, today morning itself, I was speaking to somebody about this one factor, that actually see, insurance, health insurance covers you in case you've been in hospital for more than 24 hours. And the number of people who are spending 24 hours in hospital has actually reduced dramatically in the last 3 months. So actually, people should, in a way, be saying hospitalization costs are going down or whatever, right? You know, basically per individual are going down. Of course, hospital costs are where they are. But on the other hand, we are seeing a different phenomena where people are buying more health insurance out of fear of hospitalization costs. And those are linked specifically to COVID. So I think the fear psychosis created by COVID is far higher because of the, see, you're not, none of us are discussing how many people in the country died because of accidents, how many people died because of malaria or dengue or, other kind of diseases or of cancer or of heart disease. Even today, I'm pretty confident that the number of people expiring because of heart disease or accidents is far higher than COVID. But the focus and the data availability on COVID is so high that it is driving the decision. But you know what, from a decision perspective, when I look back, I think it's okay, because it is not like everybody's going to get hospitalized for COVID in the next 3-6 months. But once they have these policies, they could actually come in helpful if they have a heart condition or if they have an accident or if they have anything else. But yes, it's a strange dichotomy that people do not see it till it's actually, put plastered out there through various, media and government and everybody else. And right now there's hysteria behind COVID and has been for the last 3 months, since pretty much March.
I take this point really well, Yashish, but the other thing I want to understand is that when you also say the insurance business is doing well, and because of, a pandemic, a lot of people who had been sitting on the fence have decided, I need to get insurance. A lot of them are also, insuring, and one hears about this, how they're insuring their employees if they weren't doing it earlier. It could be domestic staff. It could be a lot of SMEs who perhaps were not insuring, all the workers in the factories or in their workshops or whatever their business is. How was it done? Because all of this would also have to be contactless, right? I understand a lot of it had been digitized, but you still had that last mile, right? Where there would be a doctor certificate, or there would be some contact when there would be an examination, for example, that would take place.
I think extremely good question. See, I don't know about the rest of the industry, but I do know that at PolicyBazaar, uh, in health insurance, 98% of all policies have been issued without a physical medical. And that's been done via telemedical, via video medicals, via various interactions with doctors, but no particular need for a physical test. Because many people have had some form of test in the past 6 months anyway. And so many people are able to provide evidence of their past tests. And so it's worked seamlessly. It's not been as seamless in the life insurance case. So I mentioned health insurance, that's happened, but life insurance, still about half the cases have to undergo a physical medical test. And what we have to appreciate is it's mostly the physical medical tests are required for the ones who are suffering from some pre-existing condition. And those are the people who are the last people who should be going to a hospital to get a test done. So I think it's a difficult situation on the life insurance issuance front. But health insurance, thankfully, the technologies have been put in place where it is working quite seamlessly.
You know, it's very sad, but a lot of businesses are considered to be recession proof, right? Like, for example, it's always considered that healthcare is recession proof, education will be recession proof because, you know, what do you do even if there's a recession? If you're sick, you're going to need help. You know, if there's recession, you still want your kids to be educated, right? What does that mean for the insurance world? Because, you know, now, like I said, people will want to get insurance. You're seeing scary stories like, you know, you get COVID-19, you're paying almost 60,000 bucks a night in hospital, right? So people want to get insurance. So like you also said, this is not the perfect time maybe, but it has happened, right? Has it meant higher premiums? What is a spike in insurance covers?
No, the premiums, so the good news,
of how
I think the
have
good
changed
news,
since, let's say, 23rd March.
I think the good news is the premiums have not, in the health insurance space, gone up. The regulator has kept a very close watch on premiums. And really, you know, made sure that the industry did not increase premiums at this time. In fact, the role of the regulator and I do not say it because, you know, the regulator is obviously very important to us, but the role the regulator has played in the life insurance side in keeping premiums controlled is simply phenomenal, and we are seeing it on a weekly basis. Because in the life insurance industry, there's a lot of pressure on premiums to go up. So I think premiums have not gone up yet. Of course, if COVID becomes a massive scare and, you know, insurance claims really start shooting up because of COVID, then one cannot foretell the future. But as of now, premiums have not gone up.
What has it meant for PolicyBazaar? What has COVID meant for PolicyBazaar? You know, you've talked about how you rose to the challenge. You know, it's been difficult in life insurance. I'm sure, you know, like other kind of insurances would have been difficult. If I want to insure my house, you can't inspect my house, right? So I understand those challenges. But what has COVID meant for PolicyBazaar? And if it's been good for business, what has it meant for your valuations? If you've rolled all this out, you must have had to incur investments as well.
So there were three trends which have been going on for the last 12 years. First trend is people knowing a little more about life insurance and health insurance than they knew yesterday. So that's been growing. The second trend is people buying digitally. And the third trend is there being a lot of data and analytics in the background that allows us to complete a transaction digitally and also handle claims digitally. All three have advanced dramatically during COVID. Just to give you a perspective, health insurance, thankfully, we have moved to pretty much 100% issuance with no physical contact. In life insurance, the number I mentioned, we were at 30% issuance without physical contact. Today, we are at almost 75% issuance without physical contact, right? So I think things have moved very dramatically. Had COVID not been there, it wouldn't have been as swift. I think, unfortunately, people's attention on health insurance and life insurance has also expanded, has also increased dramatically. This was that attention was a much needed thing. It should have happened earlier. It should have happened much earlier. Even today, COVID is not the largest reason for cost. And as COVID is expanding, actually, the healthcare costs have been dropping in the country. As we mentioned, the number of hospitalizations, etc., because planned surgeries plus minor ailments, nobody's going to hospital, right? So I think it's in a way a blessing in disguise. In a way, of course, it's a very sad situation, but in a way, it is that more people are buying health and life cover, and more people are buying it remotely. And so now, PolicyBazaar has been the sort of, what do I say? It was the one who thought about this in the first place and kind of thought about that more people should have health insurance, life insurance. We have spent upwards of 1,000 crores in the last 12 years communicating this message to people that buy more life insurance, buy more health insurance. No other distributor in this country has ever done that. 1,000 crores is a lot of money. And of course, today we are the brand which most people are coming to. So when people start searching, they come to us and they get the products. And thankfully, in 95% of the cases, we are able to satisfy the consumers. And yes, there will be some unhappy customers also. We can never be perfect. We are always trying to improve. But yes, for PolicyBazaar, it's been a positive. I genuinely don't look at valuations, etc. But from what I hear, valuation is a lot higher than it was before the crisis. Yeah, that's it.
How much? How much higher?
I genuinely don't know. Maybe we are 2 billion, maybe we are 5 billion. I don't know.
Okay.
Numbers. Doesn't matter.
These are Yashish Dahiya, what I would say could be first world problems. These are first world problems.
Yeah, exactly.
About 2 billion valuations, $5 billion valuations.
That's what I said, right? It can be a range of 2 to 5.
Unfortunately, we're completely out of time.
Thank you.
Okay, we're completely out of time. Yashish, I was really enjoying this conversation. I wish we had more time, but my producer's queuing me. We have to make money. We have to take a commercial break. But I look forward to getting you back on this show. Thanks for coming.
Right.
And ladies and gentlemen, it's a wrap. See you same time tomorrow.